The article related to this video series is going to discuss the biomechanics of the thorax, including the thoracic segments and the ribs. So what we're going to do is demonstrate how to assess for those biomechanics. So we're just going to start with thoracic flexion. What you're going to do, have the patient do is flex forward. That's going to produce flexion through the thoracic spine. And then you're going to start at their spinous process, go out to the sides, and you're going to feel for depth at the facets. And what you're feeling for is to see if one of the segments feels more posterior or more shallow, and that's going to indicate that that segment has not slid anterior and superior, which is the normal biomechanics for this part of the spine. What you're going to do is if you feel, we'll say this segment is more superficial or more shallow, you're going to then block the level below, and you're going to attempt to anteriorly and superiorly glide the facet. And you're feeling for hypomobility. Then what you can do is you can test the level above and then test the level below to see what the normal end feel is like and if your dysfunctional level has an abnormal end feel. Then what you're going to do is you're going to lay the patient down on their stomach, and what they're going to do is put their elbows together so they're going to move their scapula out of the way. And then what we're going to do is we're going to go next to them and look straight ahead for me. You're going to do the exact same thing. You're going to feel for depth. And what you're looking for now is to see if one of them is deeper. The normal biomechanics for this is the facet is going to slide inferiorly and posteriorly. So if you find one that's more shallow, deeper, what you're going to be finding is that it hasn't slid posteriorly and inferiorly. So if we say that this level is deeper, what we're going to try to do is we're going to block that level, and then we're going to push the level below it up, which is going to be a relative posterior and inferior glide of our desired segment. Same thing, then we can compare the level above and the level below for normal end feel.